Welcome to our video about diabetes and mental health. Although diabetes and mental health are two topics that don't usually go hand in hand, many people experience both. These topics may include depression, relationships, and adolescence. The best way to get help is to talk to your doctor about your concerns. There are many resources available, and you should never feel ashamed to seek help. If you're suffering from depression or anxiety, don't hesitate to get help. You're not alone. Relationships. Understanding the relationship between diabetes and mental health is important in order to improve the quality of your life. Both diabetes and depression are serious conditions. If you feel depressed or anxious, you should seek help from a mental health professional. Talking to a therapist or support group can help you recognize and manage your symptoms. Exercise can also improve your overall well-being and help you cope with your diabetes. It can help you avoid depression and anxiety. Research suggests that diabetes and mental health go hand in hand. Depression and diabetes are highly comorbid, and they increase the risk of cardiovascular disease, CV, mortality. However, the mechanism is not clear, and the two conditions are influenced by a variety of factors. Some studies show that diabetes increases the risk of comorbid depression and vice versa. While the mechanisms are complex, it is important to recognize that diabetes and depression share a high risk of developing each other. Studies show that people with diabetes experience higher rates of depressive episodes than the general population. Depression is associated with a fourfold increase in symptom burden and is significantly associated with decreased self-management activity. People with diabetes are less aware of their surroundings, which may increase their risk of developing psychiatric disorders. The presence of diabetes increases the risk of developing complications, especially early mortality. Researchers are also investigating the relationship between diabetes and mental health. In women with diabetes, a higher prevalence of depression is linked to a higher risk of pregnancy. Increased screening may improve pregnancy outcomes for women with diabetes. Similarly, the increased risk of diabetes and depression in women with psychotic disorders may be related to antipsychotic medications. Ultimately, both conditions are important to the health of the general population. These findings suggest that improving screening programs may improve the outcomes of both types of diabetes in women. Depression. Studies have shown a relationship between depression and worsening diabetes complications and premature mortality. Depressive symptoms are associated with impaired metabolic control, missed medical appointments, and poor self-management of diabetes. In addition, they are associated with increased inflammation and subclinical hypercortisolism. Despite the strong link between depression and diabetes, a number of factors may explain the relationship. Below are some reasons why depression and diabetes may be interrelated. Treatment for depression may involve counseling, therapy, or medication. Medications, such as antidepressants, are generally well tolerated and safe for those with diabetes. Although therapy can provide temporary relief, it can take a while to see full effects. Antidepressants, for example, may take weeks to work and may be used in combination with psychotherapy. The doses and prescriptions may need to be adjusted as a person's body responds to them. The costs of treating depression and diabetes in adults have been linked to increased costs. However, it is not clear whether screening for depression in this population increases healthcare costs. Moreover, it is not known if depression treatment will reduce diabetes-related days in the hospital and decrease outpatient costs. Further, the study sample was not very generalizable to other settings and may have lower socioeconomic barriers to treatment. Nevertheless, the results are encouraging. While depression and diabetes are interrelated, both conditions can be treated. Treatment for both conditions involves different techniques. Your diabetes care team can refer you to a mental health care provider for additional evaluation and treatment options. Cognitive behavioral therapy, CBT, helps you to develop helpful beliefs, while the behavioral aspect teaches you to take healthier actions. It is a long-term solution, and the earlier you start, the better. Adolescence. One of the most important areas of healthcare for adolescents with diabetes is managing their mental health. As young people age, the risk of depression can increase. Although the signs and symptoms of depression are often subtle, a number of risky behaviors can be problematic. Several ways to manage risky behaviors are described below. These methods may help parents support their adolescents with diabetes. Listed below are some suggestions for parents to encourage healthy mental health for adolescents with diabetes. In the study, adolescents with type 1 diabetes reported significantly higher rates of somatic complaints than those without. These adolescents reported significantly more back, abdominal, and dizziness symptoms than those without diabetes. No significant differences were observed in the group or gender. The authors recommend that adolescents with diabetes receive more education and treatment from healthcare providers to help them manage their diabetes and develop healthy mental health. Lastly, parents should discuss the importance of establishing trusting relationships with their children. While the relationship between diabetes and depression is complex, it is important to remember that teenagers with type 1 diabetes are especially vulnerable to the symptoms of depression. According to the SAMHSA National Survey on Drug Use and Health, adolescents with diabetes reported significantly higher rates of major depressive episodes than their peers without the disease. There is a difference between experiencing major depressive episodes and diabetes distress. It is important to differentiate between the two in order to treat diabetes-related mental health in adolescents. In the past, adolescents with type 1 diabetes did not experience higher rates of mental, emotional, and behavioral problems than those without diabetes. While these groups did experience greater levels of stress, resilience was not significantly different from those without diabetes. In the future, researchers should examine these differences in order to better treat these young patients. These young patients may also benefit from improved medical practices and a better diet insulin matching approach. Blood glucose control. Researchers have studied the association between mental health and blood glucose control. They have also focused on the disparities in diabetes, especially among minority populations. For example, psychologists are incorporating mental health treatment into border clinics, where patients are mostly Mexican American. To ensure cultural appropriateness, psychologists are sending Spanish-speaking lay health workers to patients' homes to gather information on mental health. A study conducted by Brannon and colleagues also identified the relationship between diabetes and mental health. Increased blood sugar can lead to reactive hypoglycemia and hunger, which may be connected to the development of depression and anxiety. Studies have also demonstrated that glycemic highs and lows are linked to depression and bipolar disorder. In addition to mental health issues, diabetes and poor blood sugar control impact other metabolic processes, including glucose metabolism. By controlling blood sugar levels, patients can improve their overall well-being. One benefit of precision monitoring is the ability to identify subgroups of people who are impacted by glycemic control and mental health. These subgroups could then receive targeted interventions that address specific problems in the glycemia-related domains. Such interventions could also be effective in routine care. A study of these factors would identify the optimal treatment for each subgroup. This way, individualized therapy strategies could be used to address both mental health and diabetes. Although there is a link between diabetes and mental health, further research is needed to find out whether there is any connection between the two. However, research has shown that individuals with good glycemic control experience improved mood and overall health. Taking action to improve blood glucose control can prevent mental health crises. If you are diagnosed with diabetes, you can find support in your family and friends. If you're feeling depressed, talk to them about your condition. Remember, you may need professional help if you're not able to do so yourself. Stress management. There are many links between stress and diabetes, and many people have trouble managing their blood sugar. It's important to address these issues early and have a conversation with a health professional about the benefits of stress management. The Centers for Disease Control and Prevention offers tools for health providers to help patients learn to manage stress and improve their mental health. Health professionals can help patients improve their self-efficacy by promoting healthy lifestyles and minimizing stress. Many people with diabetes can benefit from psychotherapy. While mental health and diabetes have different causes, they are both treatable. If you're struggling with diabetes-induced stress, your healthcare team can refer you to a mental health provider who can help you develop a treatment plan. CBT has two main components. The cognitive side helps patients develop helpful beliefs, and the behavioral side focuses on learning healthier actions. Cognitive behavioral therapy works well for depression and anxiety, but can also be used for other mental conditions. Another study focused on the relationship between stress and diabetes. The researchers studied participants using an online digital health program called Livongo. In the study, participants reported experiencing stress when reading their blood glucose levels. Patients who reported having higher levels of stress reported lower diabetes empowerment, increased insulin use, and worse glycemic control. Participants who had a behavioral health diagnosis also had a higher body mass index. A relationship between diabetes and mental health has been established for a number of years. The study is limited by some limitations. Participants reported their diabetes-related stress at the time of enrollment. However, participants who reported moderate or severe mental health stress were more likely to change their diet. Moreover, they were less likely to practice diabetes care behaviors. The study's methodology is cross-sectional and uses self-reported data. Researchers hope that the findings will prove useful in future studies. But further research is needed. Thank you for watching. Please like, comment, and subscribe if this was helpful.